Hello friends, welcome to the concepts of medical. I hope you guys will be fine and doing well. This is the third video about the abdominal muscles. We have just studied abdominal muscles in two videos. In the first video we just discussed their naming, that how many muscles and what are their names. In the second video we talked about their nerve supply, that which nerves supply which nerve, right? In this video we are going to talk about their attachments, their origin, insertion, actions and nerve supply as well, because I have just wrote all these things before so that I can just explain for you guys. So the first muscles we have is the external oblique muscles, and it is also called external abdominal oblique. So its origin is anterior angle of the lower 8 ribs, means from the 5th ribs to the 12th ribs and to the interior side, their angles, these muscles are originated, right? Its insertion is the outer surface of the outer interior half of iliac crest. Means iliac crest, there are two crests in the hip region. We have iliac crest and pubic crest. So the outer interior half of the iliac crest is the insertion point of the external oblique muscles. It is also inserted to the inguinal canal, pubic tubercle, pubic crest, aponeurosis of the interior rectus sheath. Pubic tubercle is also a part in the hip region. We will all, if you are not familiar with these terms and terminology, we will discuss these terms and terminology all in the pubic region when we are making the pubic videos about the pubic anatomy, right? So this is the pubic crest, and pubic crest is actually, this is the most prominent part of the ilium, and it also make the wing like structure about the pubic bone. So it is also the insertion point of the external oblique muscles, and it is also there is aponeurosis of the interior rectus. And its action, what is its action, means what is the function of the external oblique muscles. So its function is support abdominal wall, assist forced expiration, means when we expire forcefully, so this muscle helps in that action, right? It also aids raising internal abdominal pressure, abducts and rotates trunk, means when we moving away our trunk from the midlines, so these muscles help in that moment. And its nerve supply is interior primary rami, means from T7 to T12, or it is also called interior rami of the lower thoracic spinal nerve from T7 to T12. So here we have another muscle, the second internal oblique muscles, and it is also called internal abdominal oblique. Its origin is lumbar fascia. Lumbar fascia, what is fascia? Fascia is actually, it is a band of or sheet of the connective tissues, primarily collagens beneath the skin, that attach, stabilize, enclose and separate muscles and other internal organs. So to the lumbar side and to the lumbar, in the lumbar region there is a fascia which is called lumbar fascia. So this muscle is originated from that region, and it also originated from the interior two-thirds of the iliac crest. Actually we study the iliac crest in three parts, and two parts is to the interior and one part to the posterior side. So it is attached to the interior two-thirds of the iliac crest, also lateral two-thirds of the inguinal ligament, and its insertion is the costal margin, aponeurosis of the rectus. Costal margin is actually the margin in the edges of the costal cartilage, right? And aponeurosis of the rectus sheath. Aponeurosis is actually a white band of connective tissues and the rectus sheath, means in the abdominal region, right? And it's also conjoint tendon to the pubic crest, mean the tendons which join and which associated with the pubic crest. It is also attached, this muscle is also attached to that tendon. And pectinial line, pectinial line is actually a line in the pectinial region, in the pubic region, right? And its action is support abdominal wall, and both of these muscle action is actually the same, but it's a little bit different, and it's also the same, not too much difference here. But support abdominal wall, assist force respiration, mean both inspiration and expiration here, and aids raising intra abdominal pressure, abducts and rotates trunk, means abducts moving away the organ moving away from the midline and rotates the trunk. Conjoint tendon support posterior wall of the inguinal canal, means the tendon which is associated with this region is helping to the posterior wall of the inguinal canal, and its nerve is anterior primary rami, means and it is also plus here is there is it is supplied by two nerves. First nerve is anterior primary rami and the second is ilioinguinal nerve. So here we have the third one muscle, which is the transversus abdominis. This is also the anterolateral abdominal muscle. So its origin is costal margin. Costal margin means the margins or the edges of the costal cartilage, right? And its another origin point is the lumbar fascia. Lumbar fascia is actually anatomical term for the lumbar region. Structure in the lumbar region consist of the band or sheets of the connective tissue fibers, right? And anterior two-third of the iliac crest. Iliac crest we study in the three parts, two anterior and one posterior. So the interior two-third part of the iliac crest is also the origin point of the transversus abdominis muscles, right? And lateral half of the inguinal ligament. This is also the attachment point for the transversus abdominis muscle. So its insertion is aponeurosis of posterior and anterior rectus sheet, means the posterior and rectus anterior rectus sheet aponeurosis. Aponeurosis is actually also the connective tissues. It is in a whitish connective tissue above which help in the attachment for the muscles to the bones or to the other organs. So posterior and anterior aponeurosis of the rectus sheet is also the attachment point for the transversus abdominis muscle, right? Conjoint tendon to pubic crest, this is one part and this is another structure, pectinial line. So the tendons which is associated to these two structures are also the attachment point or site for the transversus abdominis muscle, right? Its action is support abdominal wall, right? It's also the common action, aids force expiration, raising intra-abdominal pressure. Conjoint tendon support posterior wall of the inguinal canal, and its nerve is anterior primary rami, means from T7 to T12, and ilioinguinal nerve L1, right? Here there is the fourth one, muscles. Here the transversus abdominis muscles nerve supply, and the second one, muscles, we talked about the internal oblique muscles, and these two muscles are actually supplied by the same muscles, same nerve, right? Anterior primary rami, means from T7 to T12, and ilioinguinal nerve, this is also supplied by these two nerves, and this muscle is also supplied by these two nerves, right? Here is the fourth one, muscles, which is the rectus abdominis muscle. It is actually it is also called abs. The six packs in the bodybuilders abdomen region is actually the rectus abdominis muscle, right? Its origin is pubic crest. Pubic crest is the medial to the pubic tubercle, is the medially to the pubic tubercle is actually present the pubic crest, which extends from this process to the medial end of the pubic bone. So pubic crest is also the part of the hip region, it is the attachment point for the rectus abdominis muscles. And pubic symphysis is actually the cartilaginous, secondary cartilaginous joint located between the right and left pubic bone, right? So these two structures are the attachment point for the rectus abdominis muscles. Its insertion is 5, 6, 7 costal cartilage, medial inferior costal margin, posterior aspect of xiphoid process, means posterior side xiphoid process is the also attachment site for the rectus abdominis muscle, right? And its action is flex trunk, means help in the flexion of the trunk, aids force expiration, raise intra-abdominal pressure. These are the common function. And nerve is anterior primary rami from T7 to T12. So here the rectus abdominis muscles nerve supply, and the first muscle we study here is the And the external oblique muscles, its nerve supply is also anterior primary rami, and its nerve supply is also anterior primary rami. So these two muscles, the first one and the fourth one muscles is supplied by the same nerve, and the second one muscle, internal oblique muscles, and the transversus abdominis muscles, and the third one muscles is supplied by the same nerve, right? So here we have the fifth one muscles, which is pyramidialis. It is actually the vestigial muscles sometimes, and in some people it is present, and in some people it is absent, right? So its origin is pubic crest anterior to origin of the rectus abdominis, right? And its insertion is lower linea alba. Linea alba is actually the mid line and the abdominal abdomen between the rectus abdominis muscles in the whitish form. So its lower part is the attachment point for the pyramidialis muscles, right? And body of the pubis means the interior surface of the pubic body is also the attachment point for the pyramidialis muscles, right? And pubic symphysis, which is the joint between two pubic bone, is also the attachment point, right? Its action is reinforces lower rectus sheath. It means give strength or stimulate or something like that is the action of this pyramidialis muscles. Nerve is the subcostal nerve, or we can also call it the interior ramus of T12. Means it is also this muscle is supplied by only one nerve root, right? So here we have the sixth one muscle, the psoas major. Till now we were just studying the anterior abdominal wall muscles, but now we just start the psoas major, which is the posterior abdominal wall muscles. Here in this chart we were just categorizing these muscles in two part muscles of the interior lateral abdominal wall, in which we just cover the external oblique muscles, internal oblique, and transversus abdominis, and rectus abdominis, pyramidialis. All these muscles we just cover their attachment and their actions, also their nerve supply. Now we just come here to the muscles of the posterior abdominal wall, which is psoas major, psoas minor, iliacus, and quadratus lumborum. We will just talk about their attachment, right? So here we go. The psoas major is origin its transverse process of L1 and L5, means the lumbar vertebra first to lumbar vertebra fifth. Its transverse process is the origin point for the psoas major muscles. Bodies of T12 and L5 means thoracic vertebra 12 and thoracic vertebra 12 to lumbar vertebra 5th body are the transverse are the attachment point for the psoas major muscle, right? And internal vertebral disc between bodies of T12 and T12 to L4 means also the intervertebral disc is also associated for the origin of psoas major muscle, right? Its insertion is middle surface of lesser trochanter of femur, means in the femur, in the upper femur region bone, we have two trochanter. What is lesser trochanter and another is greater trochanter. So the middle surface of lesser trochanter is the insertion point for the psoas major muscle, right? Its action is the flex and laterally rotates the hip, means it also helps in the flexion of the trunk and also helps in the lateral rotation of the hip. When we laterally rotates, so the psoas major muscle helps in that moment, right? And its nerve supply is interior primary rami of lumbar 1 and lumbar 2, right? So these two nerve roots is the nerve supply for the psoas major muscle, right? Here is the seventh muscle, which is psoas minor muscle. Its origin is body of T12 and L1, right? Intervening intervertebral disc. Insertion is the fascia over psoas major and iliacus. Fascia, I've talked about fascia before. That fascia is actually the band or sheet of the connective tissue consisting of the tissue fiber. So above the psoas major and the iliacus muscles, there is a fascia, which is the insertion point for the psoas minor muscle. Its action is weakly flex the trunk, means weak flexor of the trunk, and nerve supply is the interior primary rami of L1, right? Here is the eighth one muscle, which is iliacus. Origin is iliac fossa within abdomen. Fossa is actually, I've talked here the fascia and fossa. So what is fossa? Iliac fossa, it is the large, smooth, concave surface on the internal surface of the ilium. Ilium bone, to its internal surface, there is a smooth, concave-like like space and surface, which is called iliac fossa. So that iliac fossa is the origin site for the iliacus muscle, and its insertion is the lowermost surface of lesser trochanter femur. So we talked about this lesser trochanter before. So it is the insertion point as well for the iliacus muscle. Its action is flex medially, rotates hip, and nerve is femoral nerve in the abdomen, means femoral nerve in the abdomen, and nerve root is L2, L3. In some books it is also L2, L3 and L4, right? So you guys can memorize both of them, right? Here is the last one muscle, which is the quadratus lumborum. Its origin is epiphysis of transversus process of lumbar vertebra 1 to lumbar vertebra 4. So their transverse process is actually the origin point for the origin for the quadratus lumborum muscles, and iliolumbar ligament is also the attachment point for the Quadratus lumborum. Posterior third of the iliac crest. We talked about the interior two-third of the iliac crest before. So this is the posterior two-third is the attachment point for the quadratus lumborum, right? Insertion is its insertion is the inferior border of the 12th rib. Means to the inferior border of the 12th rib there is this is the insertion point for the quadratus lumborum muscle. Action is fixed 12th ribs during respiration. It means that whenever we inspire or expire, so the quadratus lumborum muscles helps in the fiction, means it fixes the 12th ribs in its own position. Lateral flex trunk, laterally flex the trunk, and its nerve supply is interior primary rami of T12 to L3, means from T12 is L1, L2 and L3. Alright, so these are the nerve roots for the nerve supply of the quadratus lumborum. So this was all about the abdominal muscles. We just talked about its naming, its nerve supply, its function, and its attachments. If you want these charts and these pictures and these notes in the picture form, you can go and visit my Facebook page. You can easily download it from there. I will upload it there, so you can easily download all these notes and picture from them. You can also take screenshot from them.